Thank you for the introduction and thank you for introducing today's topic. So, as today's topic is COVID-19 vaccine rollout plans in India, and coincidentally, as Mango sir mentioned, today is when the vaccination drive starts. It begins at 10:30. So in about 15 minutes, 20 minutes, the vaccine rollout is going to begin. And so how did this whole thing came about? How everything was planned? And not much information about the planning aspect was initially released until it was almost ready to carry out this vaccination drive. So I'll discuss the background of this rollout plan with you guys. Okay, so what government planned? It was a multi-level mechanism, and they had set up. Can you hear me clearly now?
Yeah, if you could be a little louder, that would be still better. But sure, we are able to hear you.
Sure. So it was a multi-level mechanism, and what government did, they set up something called Negwek, or National Expert Group on Vaccine Administration for COVID-19. And it was at several levels. So as you know, with such a massive vaccination drive effort, it has to be coordinated and held accountable at various levels. So there was this national level overseeing committee, and then there were state level, district level, and block level task forces and teams. So at state level, they had state steering committee, state task force, and state control room. At district level, they had similarly district task force and urban task force and district or municipal control room. At block level, they had a block task force and a block control room. Now, these were set up to carry out operations in two phases, for preparatory phase and the implementation phase. So currently, as you know, from today, we are in the implementation phase. Now, Negwek, let me minimize this. Negwek is National Expert Group on Vaccine Administration for COVID-19. It is chaired by Dr. V.K. Paul, Niti Aayog member of the Health Division. And it is co-chaired by Secretary of Ministry of Health and Family Welfare. This Negwek has representation of secretaries from various divisions of the government, various bodies of the government, that is Ministry of External Affairs, Department of Biotechnology, Department of Health Research, Department of Pharmaceuticals, Ministry of Electronics and Information Technology, as well as Director of General Health Services, Director of AIIMS New Delhi, Director of National AIDS Research Institute, and representatives from National Technical Advisory Group on Immunization, Ministry of Finance, and to represent the entire country and for equitable distribution, state governments from 5 states are represented in this Negwek group. This Negwek was set up with the aim to guide on all aspects of COVID-19 vaccine introduction and in India, including regulatory guidance on vaccine trials, vaccine selection, which vaccine should be distributed, receive regulatory approval and distributed for vaccination. That distribution has to be equitable, so not favoring one region over the other. So equitable distribution of vaccine had to be ensured, and for that they had equal representation from all states. Procurement of enough supply of vaccine, financing the whole system, delivery mechanism, prioritization of population groups that we know, and I'll talk about it a bit more later. Vaccine safety surveillance. So you have to live monitor, because this vaccination effort was done, carried out in such a remarkable amount of time, that is almost about a year. हितेन जी marks हटा दीजिए screen से. So vaccine safety surveillance has to be done regularly. Regional cooperation and assisting neighboring countries is also one of the things. So as you can see, just in today's news, Serum Institute announced that they will send 2 million doses of Covishield to Brazil. So we are not only producing enough supply, aim to produce enough supply, vaccine supply for our nation, but also help other countries with whom we have collaborative relationships and like important diplomatic relations. So we are also supplying vaccine to other countries already. Now, Negwek, I wanted to find out more about how it functioned, but here is one of the news from October 31st, where an RTI activist, Mr. Venkatesh Nayak, had filed an application to seek information about the terms of reference of Negwek and how it works, and what is the functioning, how is it operating, and how it is ensuring or researching all the aspects of vaccine delivery. But Health Ministry refused to divulge details of meetings of Negwek. So it was kind of almost dealt like a national security measure, where things were not divulged too much until close to New Year, when we got those guidelines that I shared with you guys. Now, now coming on to the state level, there is State Steering Committee, State Task Force, and State Control Room. The State Steering Committee, here's the structure. It is designed to meet at least once a month. It was designed to meet at least once a month. It was chaired by the Chief Secretary, and convener was Principal Secretary of Health. And members included various departments of the government. So health, women and child development, rural development, Panchayati Raj, municipal corporations, urban development, revenue, home, social welfare, sports and youth welfare, NCC, all the youth organizations, education department. So it was a very comprehensive steering committee, had representation from all different sectors that are going to play a role in the entire planning and implementation of the COVID vaccine drive, as well as educational efforts. So information and broadcasting and transport, all these logistics related department and communication related department part of it. In addition to this, we also have several development partners. As you know, with such a large vaccination drive, with such a huge effort, you need help from other organizations that have footprints and presence in various parts of India. And as we know, there are programs run by various international organizations. So they have a better hold in some regions of India, and we could use any help that we can get. So WHO is part of this committee, United Nations Children's Fund, or UNICEF, UNDP, Bill and Melinda Gates Foundation, John Snow, Clinton Health Access Initiative, Rotary, Lions Club, NGOs, civil society organizations, and all. So all these departments, so you can just see the magnitude, of the whole effort, how many different sectors had to be involved in this effort. Now, the activities of State Steering Committee are divided in two parts. One is preparatory phase, that is before the rollout of this vaccine. And then will come the implementation phase that begins today. So what all aspects are these steering committees taking care of? So they
Anshuman, would you like to change a slide? Because we are seeing is Negwek only.
Sir, do you see just the first slide?
No, sir. No, we are seeing Negwek. Aims to guide.
Sir, I can see State Steering Committee activities.
Right. So maybe, Manga sir, maybe your internet is slow or something?
So it's local?
I am able to see State Steering Committee slide.
Acha. So my slide is not changing. Anyway, so you go ahead. It's all
so
right.
Maybe you turn off the screen and turn it on so it will come to the recent one. All right, so State Steering Committee, here is the list of activities that this committee was planned to do during the preparatory phase. So we'll talk in past tense because now implementation has just started. So they aim to regularly monitor COVID beneficiary database. So, for phase one, they had to get this nationwide list of all the people who should get the vaccine first. Healthcare workers, frontline workers, individuals over the age of 50. So getting this list is a huge effort, and they used electoral roll to get this information. Their job was also to provide guidance, necessary funding, and operational guidelines. And they took help from development partners. I'll discuss about that in the subsequent slides. They ensured a proper timeline for district level planning and implementation. So you should have regular checkpoints, weekly targets.
Yes, sir.
हितेन जी attendees को म्यूट कर दीजिए. So another goal was to provide timelines for district level planning and implementation of COVID-19 vaccination drive. They facilitated coordination among members and development partners. Then review statewide cold chain preparedness, provide measures to scale up. As we know, they have the initial target of vaccinating 30 crore individuals, but it's going to scale up from week 1 to week 2 to week 3. They plan to scale it up so that we can vaccinate people as quickly as possible. And also more vaccines are coming into play, more vaccine options are coming into play. So, we might get more supply of vaccines, and we don't want this bottleneck where we have more vaccine supply, but not enough infrastructure to implement and scale this vaccination drive. So that is the job of the steering committee, to identify individuals and bodies that can help with that. Now, the job involved identifying vaccinators across government and private sectors to minimize disruption of routine immunization services. So as we know, we don't have enough doctors per number of individuals in the population. So, and they're already burdened with the existing healthcare system, where they have existing duties of dealing with patients, providing routine immunization services, as well as other healthcare services. So it is important to ensure that in the effort to provide vaccine, you're not holding back the other regular health services. So that's why you have to identify enough vaccinators. Then planning, and similarly, to ensure that and smooth functioning, you have to have planning and mapping of vaccination sessions. You have to map human resources across departments that could be deployed for vaccination sessions, for verification of beneficiaries, crowd management, because you don't want vaccination site to become a cluster for new cases, because as soon as you get vaccine, you don't get immediately immunized. So there is still time, and you have to continue to have all these preventive measures that we have for COVID-19 in place, because immediately it's not going to work. 2 to 3 weeks after the second dose is when you have sufficient antibodies and sufficient priming of your immune system to fight with the infection. Until then, you have to make sure that the infection doesn't occur. Otherwise, vaccine is going to be rendered useless. Now, their job was to communicate with district magistrates, to conduct meetings of the district task force for immunization, ensure that district adverse effects committee is expanded. Members are oriented about surveilling or monitoring these all the adverse effects that come out of vaccine drive, and handling them in a timely manner is important. Now coming on to implementation phase that has now started. So when the vaccine drive is ongoing, they have to track district level timeline adherence of overall COVID-19 vaccination implementation. So they have to ensure that all the sessions are going smoothly and the daily targets and weekly targets are met, enough people are vaccinated. They have deployed senior state level health officials to each district for monitoring and ensuring accountability. There has to be a proper media plan to address rumor mongering as well as vaccine eagerness. As you know, before vaccines are even rolled out, there are concerns. People are hesitant to get vaccinated, and sometimes unfounded rumors also start. So you have to make sure that when such a large vaccination drive is happening, rumors don't spread so much that people are not coming to the site to get vaccinated and get scared of this new vaccine that has come so quickly and not tested enough, I would say, for medium to long-term effects. So if you find any immediate reaction or anything, it has to be dealt immediately and taken care of. So that media management is very important. They have to ensure now adequate number of IEC material for timely dissemination, involve youth organizations, and social mobilization is important, and ensure the involvement of self-help groups who can go and who can deal with individual level concerns. They will regularly evaluate with districts and urban local bodies to review and resolve issues related to microplanning, vaccines and logistics, human resource availability, training, waste management. Again, it's going to be huge. Adverse effects, behavioral change, communication, and provide necessary funds that are needed. Now, after the state steering committee, there is also a state task force that is meant to convene at least once every 2 weeks. It is chaired by the additional chief and member secretary, state immunization officer. Now, again, members are similar. As I mentioned, there is representation of central government, in addition to the government departments that I mentioned in the previous slide. An additional name is Ayush here, Mission Director of National Health Mission, and representatives of central government ministries and institutions that have healthcare workers and frontline workers that need to be vaccinated. So this task force comes through dealing with the direct population of measures that the actual individuals who are going to be vaccinated and who is going to vaccinate them, identifying these individuals, both vaccinator and the recipient. There is representation from various hospitals, defense forces, and armed forces personnel. Everything is needed. And similar development partners, as mentioned with the State Steering Committee, they also help with the functioning of State Task Force. Activities, again, there are similar activities for State Steering Committee and State Task Force. I looked at the guidelines and didn't see much of a difference between State Steering Committee and Task Force. Only thing I can tell from the Task Force activities, it's more operational. Steering Committee is going to be more of the overseeing organization, whereas Task Force is going to be like working with on-field individuals and communicating with them more directly. So it will look at the live measures that are happening and then report to the State Steering Committee to take broader measures at the national level, at the state level. Implementation phase, again, as I mentioned, similar to State Steering Committee, but this is more of the actionable part of the state level team. And they will track that COVID-19 vaccination implementation is going in a timely manner. All accountable officials are accountable and doing their job properly. And all these groups that have been identified by the State Steering Committee, they're functioning properly. So that's what the function of State Task Force is. Also at the state level, the third body that has been created is the State Control Room. So it's set up by the SEPIO, or State Expanded Program on Immunization Officer, and participants include key officials who are responsible for cold chain, social media, managing informative materials, and managing better coordination between development partners so that things are done in a timely manner. This control room also has a 24/7 telephone helpline. And again, going further down the hierarchy from State Steering Committee to Task Force, this control room again is active on a day-to-day basis. So it plans every day, plans for each and every day, how the mobilization of human and other resources needs to be done, taking care of transportation, intersectoral coordination, implementation and monitoring of activities during COVID-19 vaccine preparedness and rollout. They will also ensure that all the healthcare workers and frontline workers are included from all these central government institutions and even private institutions. All healthcare workers and frontline workers are successfully enrolled, they get successfully vaccinated. So they will ensure that everyone is included who is supposed to be included in phase 1. There is a clear chain of command and communication system set up, and accountability framework is set up. This control room is linked 24/7 and live with the senior officers that are part of State Steering Committee and state level task force to take urgent decisions. Anything urgently comes up, they immediately report it to senior officers who will provide guidance and field level operation modifications if necessary. And this control room is supposed to provide regular feedback even without these urgent measures. They will provide regular feedback if everything is going smoothly to the State Steering Committee and Task Force. Similarly, I'll spend less time on the district level details because they are pretty much similar, but at the final level, at the district level. Again, district task force, urban task force, and district or municipal control room. The district task force is chaired by district magistrate and member secretary district immunization officer. The key departments other than, so chief medical officer at each district is assigned with the responsibility for smooth functioning of district task force and reports to chairperson and member secretary. Key departments, again, that mentioned in the previous slides, similar one. In addition, you have cantonment boards. Yeah, so all the departments are similar as the previous slide, nothing new here, but they work more directly and at the district level. They are supposed to meet weekly. And as we know, these development partners, they have almost grassroots level access to our population. So they are still involved with the district task force as well, and not just with the state task force or Negwek, national level representation. So they work at the ground level as well. District Task Force does the same thing. It's just part of the hierarchy where they regularly monitor that COVID beneficiary database is complete. It stays up to date. And as soon as people get vaccinated, the entire database stays up to date. and knows how many people are already vaccinated, who is vaccinated, and who is left. District Task Force ensures that training of all concerned human resources regarding the CoWIN system is done, so that they understand the functioning of this CoWIN app that they have access to. We don't have access to it yet, but they do. So they have been trained of how to do all the entries and how to see all the details on it regarding administrative details, supply, and everything. This district task force monitors progress on key activities, that is micro planning, communication planning, cold chain, and vaccine logistics, and accountability is fixed at each activity level. All right. So similar duties, as I mentioned, and they work at the district task force level as well. Again, the district level implementation phase, all the details are pretty much the same that I have already talked about at the state level. And in addition to what I have mentioned, where disruption of routine health services should not happen, and all healthcare workers and frontline workers are identified and vaccinated, COVID vaccine rollout is monitored. They also work on requisition at the district task force. They work on requisition of required human resource and infrastructure, including vehicles. For defense personnel, district is supposed to ensure sufficient vaccine allotment, and which is to be administered by defense hospitals. So among even the prioritized individuals, these are like high priority along with healthcare workers and frontline workers. So they are part of frontline workers here. Defense personnel are part of frontline workers. District task force also ensures safe storage, transportation, and delivery of vaccine doses with sufficient police and arrangements. Robust communication planning is needed again. So they work on the same, avoiding rumor mongering and vaccine eagerness or vaccine hesitancy. They deal with that, and informative material dissemination. Now, district level, state level takes care district level is accountable to the state level bodies, and block level bodies are accountable towards the district committees. So they track block and urban areas for adherence to vaccine timeline, and they ensure that funds are allocated to all the supporting bodies and organizations that are involved in this effort, because timely disbursement is needed for continued support from them. And they share key qualitative and quantitative feedback at state level for review, and monitor meetings of district adverse effect related issues, and expedited investigation of these cases is needed. Second body at the district level is Urban Task Force. It is chaired by the Municipal Commissioner, and member secretaries, Municipal Health Officer or Chief Medical Officer of the Municipal Corporation. Urban Task Force is created in urban areas where the health services are under the ambit of municipal corporations, and it will have similar composition we have already talked about as the District Task Force. Third, similar to the state control room, there will also be a control room for district level management of all the similar issues, helpline, and looking at all the adverse effects, and compiling, collating, analyzing reports and providing them to the state level bodies, who will then give it to the national level body. So this district or municipal control room is set up at the district level by the district immunization officer, with participation of district program manager, nodal officer, NUHM, cold chain officer, representatives of key departments and partners that we have already talked about. It's important to note that vaccine related concerns sometimes are based on people's religious beliefs. So it is important that religious leaders come to the front and support this vaccination effort, and that builds confidence in the community. As Pope Francis got vaccinated, and it was announced because like all religions, there are parts or beliefs where they have concerns about whether they should get vaccinated and is it right for them. So doing it publicly in front of the whole world was important. Announcing it was important. It builds confidence, and vaccine compliance and adherence improves because of that. So religious leaders have to get involved along with CSOs and NGOs and all the welfare associations. In municipal areas, an urban control room should be chaired by medical officer of the municipal corporation. And rest of it we have discussed. Similar chain of command and providing information regularly to the state bodies about smooth functioning of each district. Coming to the lowest level discussed in the Negwek report is block level. So they have block task force and block control room, similar function. The block task force is chaired by the subdivisional magistrate or tehsildar or block development officer, and convened by block medical officer in charge. Members are block development officers, child development project officers, block education officer, elected representatives of each block panchayat. Youth organizations continue to work at block level as well. And there are representatives from relevant departments like PWD, animal husbandry, NGOs, power department, and development partners also work at the grassroots level. These activities are similar as mentioned for state and district level. There is nothing unique here to be mentioned that we have not discussed. However, they are at the block level, so they have to manage vaccination sessions, identifying beneficiaries properly, managing the crowd, and overall coordination at each session site. So when you go at the session level or at the site level, they have to, this task force has to manage each and every site in each block by the block representatives, and that it is handled properly. Then now that we are in implementation phase, they will monitor COVID-19 vaccine rollout in each block, and they have to identify bottlenecks. So they have these daily targets of each session, each session site will have 100 vaccinations done properly, and they have to identify if any site is falling short of that target and identify those bottlenecks. Is it the supply issue? Are you not getting enough registered individuals who are supposed to come there and get vaccinated? Are they not showing up? So identify these bottlenecks that might affect, meeting the daily, weekly, and monthly targets. They are involved with the requisition of required human resource and infrastructure, provide vehicle for efficient transportation so that these operations work smoothly. And as I mentioned, they will also ensure that there is minimum disruption of other routine health services. They will supervise each vaccination session that is being conducted for COVID-19 vaccine drive, and communication, adhering to timeline, providing disbursing necessary funds to these supporting bodies and vaccinators, and provide feedback to the district level for review. Similarly, they have a control room, as I've talked about at state and district level. Now, I won't go into the detail of each and one of these. As you know, that guideline document is huge. So each of these departments, government organizations that are part of the state, district, and block level committees, they have been given very specific directions, very specific tasks have been assigned to them. And so it has to be coordinated at each level, not just that they have a common meeting and all bodies and representatives are there and you just make general statements. Each body was assigned specific tasks. So I'll take a short example from this table. If you look at Ayush, so during vaccine rollout planning and implementation, the job of Ayush was to identify healthcare workers that are with Ayush and provide vaccinators authorized who are authorized to give injections, and other team members. So identify these vaccinators and identify the recipients. And as far as social mobilization and awareness generation part of this vaccination drive is involved, Ayush was given the responsibility to use its own platform for disseminating informative and education and communication material. So just an example how each body was assigned specific responsibilities. And there are, you can go in that document and see how each body was assigned these things. For example, another interesting one is here, Tribal Affairs Department. They were given the task of setting up session sites in school premises in tribal areas, and also generate awareness about COVID-19 vaccination in tribal communities and their mobilization. Animal husbandry, you must be wondering, why animal husbandry is required for these things, for this vaccination. So as you know, they store, meat, eggs at low temperatures. So they have these cold storage facilities available at animal husbandries. So they can provide, added support in, providing dedicated cold storage equipments and facilities for storing vaccines at closer sites. because they have to be kept at that temperature, and you need to have this cold chain maintained till the end. So animal husbandry even can help. So as you can see, like every possible department has been utilized. Now, what are these development partners doing that are part of this committee? Now, first, let's talk about World Health Organization, or WHO, in India. They were involved in, broadly summarizing the slide, they were involved in planning and implementation support. So they, through their National Polio Surveillance Project Network, that system, the technical support at national, state, and district level is used for planning, training, and monitoring of COVID-19 vaccine introduction activities. And support is provided in the following key areas. So coordinating with other development partners, some of them, if they don't have presence and WHO has presence in some certain areas, they can coordinate and work together and facilitate mapping of all the regions for providing vaccine. They help with supporting, facilitating capacity building trainings, and develop and disseminate training materials, coordinate in developing micro-planning for COVID-19 vaccination, and also track implementation of these rollout activities and provide necessary feedback and how it needs to be modified and done better. So that was the role of WHO as a development partner here. UNICEF was primarily involved in developing these operational guidelines that I had shared, and cold chain management, ensuring supply, and media management. So these were kind of the key areas for UNICEF. So they supported with developing entire operational guidelines and quite thorough, developing all the training content with WHO, and capacity building exercise, again, in collaboration with WHO. And they worked specifically in the domain of cold chain as well as communication. So they supported cold chain assessment, planning for need-based augmentation with time, procurement, supply, and installation of cold chain equipments, pre-campaign assessments, so doing these dry runs and assessing the situation, and supportive supervision using standardized checklists. So this feedback loop is to remove any bottlenecks and challenges. So it will continue to operate now when the vaccination drive is ongoing, that these bottlenecks are quickly identified and resolved in an efficient manner. And they also work with the media engagement and education and information at national and state level. So that was the job of, that is the job of UNICEF. Next is United Nations Development Program, or UNDP. Their primary responsibility was to develop this CoWIN system that we have for managing, tracking everything. And we'll talk about that in subsequent slides. So UNDP was leading this development effort of the CoWIN system. And CoWIN will allow beneficiary registration, micro-planning, real-time reporting of vaccination, issuing vaccination certificates to all beneficiaries who will be successfully vaccinated. This CoWIN system will be linked to existing IT platforms that are being used in other vaccination programs in India. So it is integrated with eWIN and SafeVac, and it supports in registration and creating this entire database and providing that information at the state and central level. CoWIN system also assists in capacity building of managers, supervisors, and vaccinators. So there will be additional informative material on that as well. There is, at the back end of CoWIN platform, there is a place for cold chain handlers to have information about how the cold chain is functioning, how the vaccine logistics is working. So they will have information at the back end for that as well. I'm sure it won't show up for registered users, only that is for the backend and administrative purposes. And vaccine coverage is going to be tracked and mapped out using the CoWIN system. And all right, so next there are other organizations, just a couple more. John Snow Inc. That will provide support at state, district, and block level for capacity building, micro planning, and monitoring selected districts where they have presence, and deploy staff as necessary. And they implement rapid immunization skills enhancement platform for capacity building on COVID-19 vaccination. Next is Bill and Melinda Gates Foundation. They work on a lot of projects in India. So they can help with operationalization of COVID-19 vaccination activities. Specifically, they have significant presence in Bihar and Uttar Pradesh. So they are going to help over there. And they facilitate engagement with large subscriber-based platforms, including private health sector, to augment community outreach and awareness generation. I won't go in the details, just, all local bodies and organizations at various levels, they don't have universal presence, across the nation, but each of these organizations has some presence in, certain parts of India. So wherever they can help, they are helping this entire vaccination drive. Now, okay. So COVID.
Please keep your system on mute. Only Anshuman is talking right now.
Thank you, sir. So this COVID Vaccine Intelligence Network, or COVIN, it's a digital platform. I think it is already launched. I think it was to be launched at 10:30 or something by Prime Minister Modi. So it's launching today, and as far as I know from the newspaper a couple of days ago, public registration will be available within a month. So I went to this COVIN website. Last I checked, this was I think a couple of days ago when I took the screenshot. And I tried to find, is there an option anywhere can you register? But no. First phase individuals have been identified using the electoral roll details and hospital databases, and they are already registered using their mobile number. And so those registered users, pre-registered users, I think I don't have anyone in my house to check this live. Probably some of you have. You enter your mobile number and password, and you can log in if you are a registered beneficiary already. And I'm sure there will be an option, register now or something will show up here as soon as it is made publicly available. Currently, it is not. And it is going to happen within a month, but it could be very soon, depending on how first couple of weeks of initial vaccination drive go and whether it is smooth. Now, some of the key features of this entire COVIN system, so all the back end as well as what you will see. One aspect is user management, and national, state, and district administrators will have access to this COVIN system user management portal that will have information about individual user registration, role mapping, and bulk upload of user registration. So as we saw, periodically these district and block level bodies are going to compile, collate, and upload data for the national level or state level administrators to see. So that will be accessible and visible to only these three administrators that I have mentioned here: national, state, and district administrators. Next aspect of COVIN system is inventory management. So, and that will be accessible to national, state, and district administrators, as well as cold chain handlers. So, having sufficient supply at each site, so that inventory will be managed by these four levels. They will manage inventory receipt, material allocation, and how much is left and how much needs to be provided. That will be managed by inventory management. Next is temperature monitoring, and cold chain handlers will have access to it. Program managers will have access to it. My guess is they will log, storage temperatures and whether all the freezers and cold chain aspects are working properly, log their temperatures periodically, I'm guessing. So they'll monitor this temperature regularly. If there is any power outage, and if that vaccine stock needs to be moved to another site, if that site is not working. So ensuring this and no vaccine vials are wasted, that has to be ensured. So that will be managed by this temperature monitoring system of COVIN. Next is beneficiary registration, and as you can guess by the name, not just national, state, and district administrators or block level administrators will have access to session list and beneficiary list. This part of this COVIN app is going to be accessible to the beneficiary as well, so that you can do self-registration. You can I'm guessing will have all the government stamps necessary to, file for visa or travel internationally or across borders. So that certificate can probably be used. I'm guessing, again, the app is not live, but I'm guessing it will have some sort of QR code or barcode functionality where you can scan it at the airport and, they can get the status quickly that yes, you are vaccinated, and and based on the date, maybe 2 to 3 weeks after your second dose, you are safe to travel, you have immune levels, sufficient immune levels, and that kind of thing. So I'm sure COVID system app will be on every phone by the second half of this year. Next part is session planning. And as I mentioned, the more direct involvement is going to be at the district and block level. So session planning will be done at the district level. They will create sessions, each session for each site, and allocate individuals as well as individual beneficiaries as well as vaccinators on those sites. Next is vaccination, and that part of the COVID system will be managed by the vaccinator. As soon as they vaccinate, in the vaccination team I'll talk about in subsequent slides, they will put in the system after vaccinating each individual. The supervisor will also have access to it. So what they're going to do is they will, using this system, if it is connected through the internet, then they can check through their online system about the validity of the documents that each person is going to provide. So beneficiary verification will be done, vaccination updates will be done, and if for any individual during the next 30 minutes of waiting period that they have, if there is any adverse event, anaphylactic reaction that they observe, they can report that. Even for if someone shows up after a couple of days or something and reports, this system can be used to track their vaccination history and report these adverse effects quickly, and it will be quickly available to all the control rooms and task forces immediately to handle the situation. Next is to manage this whole data. So there'll be an analytics or dashboard system accessible to program managers, and they can get a broader picture of overall beneficiary coverage, all the users, the summary data, and to prepare reports and publish maybe not daily but probably weekly reports to the media, how it is going, and for their own purpose to identify these bottlenecks and if there are any issues somewhere. So that is what the analytics will be used for. This is the process flow I have already talked about. The input functionalities are about creating these databases and managing all the vaccination and allocation and session site level information, uploading everything, all the details regarding registration and vaccination on the system. Then process functionalities, part of this COVID system will manage the process, the session management, so that it can be quickly linked online. Vaccinators, supervisors, beneficiaries can quickly get any status update or any verification done quickly using this mobile app. And output functionality includes confirmation of vaccination, and so that you have this certificate or a QR code or barcode on your phone that you can show that confirms that you got vaccinated. And it can help with monitoring and reporting, not just vaccination, but also all the adverse effects. Now, let's briefly talk about this self-registration part of the CoWIN app that you will soon see, within a month or so, within a month. You'll be asked to provide basic demographic details, that is your name, date of birth, permanent address, current address, and if you have any comorbidities. And you will be asked to provide any one of these several IDs, so they have made it quite broad. Initially, if you remember, when the COVID system related news had come out, initially there was this concern that you have to have Aadhaar card or voter ID or just a couple of IDs that will work, otherwise you will not be allowed. And that is not true. So you can provide any of these IDs to register successfully: Aadhaar card, driving license, smart card, Manrega job card, official IDs for these politicians, PAN card, passport, pension document, service IDs, and voter ID. So there are several options that you will see as shown in this screenshot from their guideline book, and you will be able to register successfully. Now, phase one, coming to the vaccination, the phase one group of individuals who are going to be vaccinated from today in the initial drive of vaccinating 30 crore individuals. So there are about 1 crore healthcare workers, approximately 2 crore frontline workers, and 26 crore individuals of 50 years and above, as well as approximately 1 crore individuals who are less than 50 years of age but have comorbid conditions that make them eligible for getting vaccinated during the phase one. And why this priority group and healthcare worker and frontline workers have been selected for phase one of the vaccination, because the goal of phase one is to protect people, minimize societal and economic impact by reducing COVID-19 mortality. So these are the high risk groups who are directly coming in contact and are at risk of getting exposed to SARS-CoV-2 infection. Now, age for this above 50, below 50, that threshold has been identified using January 1st, 2021 as the cutoff. Now, there are 9 categories in healthcare workers who are part of this phase one. Frontline health and ICDS workers include auxiliary nurse, midwives, multipurpose health workers, ASHA workers, ASHA facilitators, Anganwadi workers, and Sahikas. Then coming on to second group, nurses and supervisors. So staff nurse, public health nurse, lady health visitors, community health officers, health and ICDS supervisors, child development project officer, CMHO, district WCD officers, district immunization officers. Among medical officers, all allopathic doctors are eligible. Ayush doctors are eligible. Dentists are eligible for this phase one. And it also includes administrative posts, those posted in health facilities and institutions. So not just the doctor, but also the support staff also works over there. So they are at risk. So they are allowed as in the priority group. Paramedical staff, so lab technicians, operation theater technicians, pharmacists, physiotherapists, radiographers, nursing orderlies, ward boys, other paramedical staff. So entire paramedical staff is included in this phase one. Support staff, drivers and security staff, sanitation workers. Then students are also included in this. I don't have any direct information of how they have collected. If any of you know, can tell. Medical students, dental students, nursing students, whether the list has been pulled up from DCI and MCI registration portals that was probably used to get the list of students for phase one. Then other 3 categories are scientists and research staff that are directly involved in COVID research and dealing with high risk content, clerical and administrative staff related to relevant departments, and other health staff. So these are part of the healthcare worker category of phase one. Frontline workers are personnel from the following departments. So, Ministry of Defense, obviously the conventional meaning of frontline, individuals was these defense people. So Army, Air Force, Navy, and Coast Guards. But not just that, in this COVID-19 scenario, within the border, people who come under Ministry of Home Affairs. So Assam Rifles, BSF, CISF, CRPF, Indo-Tibetan Border Police, National Security Guard, Sashastra Seema Bal, and Home Guard, disaster management volunteers, prison staff. They are also in the frontline workers. Another initial concern when fewer details were known, people demanded that municipal workers should be considered frontline workers, and as it turns out, they were included in this phase one. And apart from that, state government, revenue officials who are engaged in COVID-19 containment, surveillance, and other activities, state police, all these individuals are considered frontline workers and will be included in phase one. Going specifically in, who is, part of this municipal workers for phase one, all the sanitation workers, waste collectors, sweepers and emptiers, waste processing plant operators, frontline urban local body staff, engineers and others, vehicle drivers for these services, cremation ground staff, maintenance staff, and other miscellaneous individuals. So a pretty comprehensive list, and that's why it constitutes of around 30 crore individuals. Now, further details about this rollout plan. How are these session sites decided for different priority groups? So we know there are healthcare workers, frontline workers, and prioritized age group. So how are the session sites defined for each one of them? Now, for healthcare workers, fixed session site is at the health facility. So any government health facility at PHC level and above, and private health facility when there are more than 100 healthcare workers at that facility. So those are the fixed session sites. So it will be delivered into those hospitals and facilities to directly vaccinate individuals who are working there and in the nearby localities. For frontline workers, the fixed session site is healthcare, government and private facilities, as well as there are outreach session sites. So office of frontline workers can be used for makeshift places for vaccination, schools, community halls, in respective residential areas are also available to vaccinate all these frontline workers. Is prioritized age group more than 50 years of age. And, I forgot to mention, so they are further stratified in terms of priority, depending on vaccine availability of more than 60 and 50 to 60. And they can go to any of the government or private healthcare facility, as well as reach out to these outreach session sites to get vaccinated. So schools, community hall, gram panchayat, and municipal corporations. So they can go there. Now, a specific layout plan has been provided for each session site. So an ideal session site all over India should have 3 demarcated rooms. One will be waiting room. Second, the actual vaccination room. And third will be observation room post-vaccination. These rooms should preferably have 2 doors. So people who are entering from one door should not get out of the same door, but go through the back exit or the second door. And these rooms should be naturally well ventilated. Waiting area should be demarcated by keeping the social distancing measures. The injection site should have ensure privacy for the patient. Adequate queue management and crowd control system is required outside the waiting area using the same social distancing measures. Access to the vaccination site should be enabled properly for differently abled individuals. And proper seating arrangements need to be done because, especially because in phase 1, you have older population getting vaccinated first. So these are some of the guidelines for each session site. Now, within each session site, there will be a vaccination team that will consist of 5 members. First will be the vaccinator officer, that is doctor, staff nurse, pharmacist, midwife, lady health visitor, but not restricted to these guys because of the sheer number that is needed. Anyone who is authorized to administer an injection was considered to be a potential vaccinator, and I'm sure they will enroll more when they scale up. So that's the first member of each vaccination team at each site. Second is vaccinator officer 1. So at least one person from police, home guard, civil defense, NCC, NSS, or NYKS will check the registration status of the beneficiary at the entry point and ensure that the entry is regulated. So kind of a security and verification personnel, vaccinator officer 1. Third person, vaccinator officer 2, will authenticate and all the ID documents using the internet and ensure that the person is not already vaccinated, not getting the next dose quickly before their time. So those kind of things will be verified by this vaccinator officer. Apart from that, the 4th and 5th member, vaccinator officers 3rd and 4th, they are support staff responsible for managing the crowd, and they will ensure that 30 minutes of waiting time is given each beneficiary after they get vaccinated. So they get vaccinated, but they don't immediately leave. They wait in the next room for 30 minutes to see if everything is okay. They will also be responsible for providing any information, education, and communication messages. So in the waiting area for before the vaccine is delivered, as well as in post-vaccination room, they will provide all the necessary information while they are waiting. So that's the vaccination team for each session site. They will check for registration. If someone is unregistered, they will not be allowed in the verification area, and support staff will help in helping those people to get necessary documentation before they come back to the site. It will not be allowed. So on-site or walk-in registrations are not going to be allowed. You have to register through COVID system in advance, and then come to the site. So that you don't crowd the site, and the vaccinating team can ensure your ID details and your vaccination status. If you're registered, you'll be allowed to enter, and it will be done in small batches. So 100 vaccinations per session per day. That is kind of the initial goal, but I think it can be scaled up as need arises. Similarly, they will see whether Aadhaar is authenticated online, or if there is internet is not available at a site, they will use their own judgment whether the ID is legit or not. Proper waste disposal of all the vaccination drive related materials will be done. They will be segregated in appropriate boxes, appropriate bins, and the waste disposal guidelines, either incinerate or deep burial, or disposing into safety pit, or providing it to municipal waste management team that can take the trash away. It will be needed because huge amount of trash is going to be generated during this vaccination. So just to summarize, during vaccination drive, essential health services will continue to work. Vaccine safety will be ensured during storage, transportation, and delivery. There will be sufficient police arrangement. Safety precautions will be taken, that is infection prevention and control practices, safe injection practices, and waste disposal during each session. The vaccination drive will be monitored. Adverse effects will be monitored, and existing systems will be used for this adverse effect reporting and monitoring. And there will be a proper referral mechanism so that patients can be handled quickly, as well as any media related attention can also be managed. Cold chain will be assessed, and gap analysis has already been done. It will be live. It will continuously be done, that the cold chain is maintained. Enough supply of human resources as well as cold chain equipments and vaccinating team will be ensured. And proper training, periodic training of new entrants, even for existing team, periodic trainings will be done, refresher training courses will be done. And COVID-19 vaccine information system will be regularly kept up to date, and there will be clear communication strategy in terms of creating adequate awareness, knowledge, disseminating knowledge, generate and manage adequate demand so that people are getting vaccinated swiftly, and facilitate eagerness, also address if there is hesitancy, and have confidence in vaccine, and quickly mitigate any unintended situation. So if at any particular site there are a bunch of adverse effects happening, so ensuring identifying what are the causes of that and immediately managing that. Proper media management of the whole thing will be done, and database will be tracked, and there will be periodic meetings at all levels that we talked about. And just to give you a recent update, an announcement was made by Additional Secretary of MOHFW. So a letter was published on MOHFW website on January 14th, so 2 days ago, and that had some information about COVID vaccine precautions as well as contraindications, and what is not included in those contraindications, and it is okay to get vaccinated. So that information was provided in that document. So there are some things to remember about COVID-19 vaccination. Authorized age group. So as you know, these vaccines have quickly been authorized. So they are under the emergency use authorization, and it is indicated only for individuals 18 years and older. So only for adults. Another reason is clinical trials were done only in adult healthy volunteers. So only adults will be vaccinated. Co-administration of vaccines, if required, COVID-19 vaccine and other vaccines should be separated by an interval of at least 14 days. So if there is any other regular vaccine scheduled, then COVID vaccine should be delayed should have a gap of around 14 days on either side. Interchangeability of COVID-19 vaccine, again, a valid question that has often been asked. What if you take first dose of Covishield and the second available is Covaxin, something like that? So that is not permitted. Second dose should also be of the same COVID-19 vaccine, because you want to ensure that same mechanism of immune system triggering, and that is done, because the doses and the type of vaccine, it is kind of, you should take same vaccine twice to ensure that you comply with the recommended guideline for vaccination. Contraindications. So persons with a history of the following should not take the vaccine. That is, if you are, with the first dose, if you had any anaphylactic reaction or allergic reaction, then you should not take that particular vaccine and seek guidance regarding that. If there is any immediate or delayed onset anaphylaxis or allergic reaction to vaccines or injectable therapies, pharmaceutical products, or food items, you need to inform what kind of allergic reactions and which specific product you're allergic to before you get vaccinated. Otherwise, it is contraindicated. Pregnancy and lactation. Since all these clinical trials were done in healthy individuals, adult individuals who, and pregnant women and lactating women were not included in these trials. So we don't know if there are any harmful effects on pregnant women or the fetus or the newborn occurs because of the COVID-19 vaccine. So women who are pregnant or not sure of their pregnancy status and lactating women should not receive COVID-19 vaccine at this time. See how the whole thing goes, and if there are like very rare occurrences of vaccine related adverse reactions and what kind of reactions they are, and that needs to be assessed and evaluated, and I think new guidelines will be released after some time as well. Provisional or temporary contraindication. So these are the situations where COVID vaccination should be deferred for 4 to 8 weeks after recovery. So if someone has active symptoms of SARS-CoV-2 infection, so if you have active infection related to a disease that vaccine is intended to prevent you from, if you already have active symptoms, there is no use of taking the vaccine at that point. If anything, it will harm. If you have an immune response, it will trigger more and it can be very dangerous. So if you have active symptoms of SARS-CoV-2 infection, then you should wait until those symptoms are resolved, you are treated properly, and then wait for 4 to 8 weeks and then take the vaccine. SARS-CoV-2 patients who have given anti-SARS-CoV-2 monoclonal, been given SARS-CoV-2 monoclonal antibodies or convalescent plasma as part of the treatment should wait for this treatment to get over, and after that 4 to 8 weeks of that, you should get vaccinated. If you are acutely unwell or hospitalized with or without intensive care, these patients, due to any illness, if you are acutely unwell, you should not take the vaccine. Not just COVID vaccine. I think any vaccine is contraindicated until your acute condition is resolved. And special precautions, it should be administered with caution in persons with history of any bleeding disorder or coagulation disorder. So you have to practice caution when you are vaccinating these individuals. Now, when COVID-19 vaccine is not contraindicated. So if person has a past history of SARS-CoV-2 infection, they came out seropositive during one of these, seropositivity surveillances, or you have RT-PCR positive illness, any other illness, then it is not contraindicated. If you have a history of chronic diseases and comorbidities, any cardiac, neurological, pulmonary, metabolic, renal diseases, or any malignancy, then it is not contraindicated. In fact, many of these comorbidities put you at a high priority of getting vaccinated soon, because the mortality rate is higher if you get the disease and you are not vaccinated. Now, if you are immunodeficient, have HIV, taking any immunosuppressive drugs due to any condition, any autoimmune disease or cancer or something, then COVID vaccine is not contraindicated. Now, since you are kind of immunocompromised, you may not generate or trigger as much immune response to the vaccine as a healthy individual, but any immunity is better than no immunity. to the disease. So it is not contraindicated and you can take the vaccine. And as we get more information from these vaccination drives, these guidelines will be updated, and based on how the vaccination drive is going, it will be updated. Now, this was a summary of these guidelines, and you can get more information from these booklets that were shared previously. Thank you.